I call the honourable member for Lyons.
Thank you, Madam Speaker. My question is to the Minister for Health. Could the Minister please explain how abolishing the carbon tax will help bring down costs in the health sector?
I call the honourable Minister for Health, and there will be silence on my left, including the member for Bendigo.
Thank you very much, Madam Speaker. Now, we know that the Labor Party is not too good with numbers, but they surely realised when they imposed the only economy-wide carbon tax in the world that it would apply to health services. Now, surely they realise that the hospitals, the pharmacists, the dental practices, GP practices around the country, every time they use energy, it is a cost that they cannot absorb, that they must pass on to consumers. And what does it mean, Madam Speaker? It means that they are taking away the capacity to put more into frontline services. Now, in New South Wales, we know that Treasury analysis in New South Wales says that the carbon tax, Labor's carbon tax, would impose $26.5 million onto the New South Wales health system. Now, the amazing thing is that Labor just doesn't get it. Even today, they don't realise that hospitals in other countries do not face this carbon tax. This carbon tax takes the capacity away to deliver more surgery. It makes it harder for doctors, Madam Speaker. It makes it harder for doctors to see those patients. It makes it harder for pharmacists to provide those services because they are paying the carbon tax implemented by the Labor Party every time they flick on the switch or they pay for those goods that are coming into their particular practice. Now, we know in Victoria, Madam Speaker, that analysis there means that each and every year the carbon tax will cost $13.5 million as it applies to electricity and gas in their hospitals and across their health system, and it grows each and every year. Now, it made me think about the scene from Yes Minister. Where they talk about the hospital being perfect except for the fact that it's got patients in it. The problem is, Madam Speaker, our hospitals do have patients in them, and we need to keep the lights on. We need to make sure that the operating theatres continue. We need to make sure that the intensive care units keep operating. We can't turn off the power. I'm not sure if this is some sort of revelation to the Labor Party, but we can't turn the power off. They have to pay the carbon tax every time. Every time they use gas or electricity in these public hospitals, they are paying the carbon tax. Now, my advice to the Labor premiers and to the territory chief ministers is that they get on the phone to this Leader of the Opposition, because Bill Shorten is the only person who is standing in the way of the abolition of the carbon tax, and the Leader of the Opposition needs to get out of the way, get this carbon tax off the back of all Australians.